It's really good to be here with everyone as we get started. Happy November 1st. I can't believe it's November already. So welcome. We're excited to get everyone here and get started. What we'll do is we're not going to do any introductions today because you'll all have the opportunity to work in small groups. And so we encourage you to do those introductions as you have your time in your small groups to talk with one another. I want to welcome everyone. Again, my name's Nuto Haynes. I am the facilitator for this meeting. We have Christy Hudson, the lead from OHA, and we have some other OHA staff, Heather Owens, and I believe Liz Garst will join us if she hasn't already. So welcome to everyone. A couple quick notes for our time together today. We do have the closed captioning that's available to folks. And to get to the closed captioning, at the bottom of your toolbar, your menu bar, you can select CC for closed caption. And so once you click on that, I believe it gives you some information on how to get closed caption for today. And then also for our Spanish interpretation is available. So we are asking that all the attendees for today's meeting select Spanish or English channel to follow the announcements. And so you again do that by, let's see.
I have to set it up, and I'll do so after Mark or Karina have a chance to make that announcement in Spanish.
Okay, perfect. Thank you. And then my last note before we get started is that there's not going to be any formal public comment period today, but we do invite the public to listen in and comment and chat in the chat box if you have a comment. And then also you can email us at publichealth.policy@state.or.us. That'll give you an opportunity if you had any questions, and somebody from our policy team will reach out to you and get you the information that you need or answer your questions. So with that, welcome everybody. We're going to go ahead and jump right into it. I wanted to kind of first start off by just thanking the steering committee meeting. In October's meeting, we had folks that stepped forward to, all folks stepped forward to be part of the steering committee. And Christy and I were just delighted to have this group come together last month. They met a couple extra times, which was great for us. And it was really an exciting process to kind of hear from these folks that will help guide the process for the continued work in 2022. And so with that, I'm going to ask that we didn't leave the two meetings with anybody who is going to be the co-chairs. However, there was so much excitement around it. People did want to step up and volunteer to offer up notes from the steering committee. And so they are volunteering to do that on a rotation basis the next couple of meetings. And so that's great. And so first I'm going to invite Stan to go ahead and report out on the process, a couple of, quick notes from those two meetings that we had in October. Stan?
Hey, New. Sorry. Okay, I just want to pause and have Mark or Karina make an announcement about interpretation.
Sure.
Service on.
Thank you.
Sí, ¿qué tal? Buenas tardes. Bienvenidos acá al Partnership reunión para el 1 de noviembre. Simplemente el anuncio para informarles que tienen la opción de escuchar esto en español. Y en ese caso van a necesitar seleccionar abajo en el globo terráqueo, el globito, el idioma de preferencia, español en este caso si me están escuchando y prefieren este idioma, como para poder participar y escuchar la sesión en español. Muchas gracias.
Thank you, Mark. And again, just as a reminder, if folks go down to the menu bar, you'll see interpretation, and you can select English or Spanish. Thanks for the reminder, Christy. I just get going. I get so excited. So is Stan on the line?
Yeah, I'm right here. How are you guys doing today?
Good. Thank you, Stan. I just gave the quick lowdown that we had a couple of really additional meetings and really good conversation. And so I'm going to turn it over to you as one of the steering committee members to report out.
Thank you for this opportunity. And on behalf of the steering committee, we want to thank each one of you for the opportunity of serving you in this way. And we do want to have good, regular communication. So do not hesitate to reach out to any one of us at any time with any questions or comments or what you would like to see happening. And what we, for the moment anyway, the next several meetings we are going to share. So I'll be reporting today, and next time it'll be someone else and so forth. Now, our true desire is to serve and to do our very best to lead us in a good direction in order to accomplish the strategies of the partnership. We met twice this last year, or this last month since our last meeting, and we discussed the need for further clarifying the role of the partnership and the impact of strategy prioritization. We are still needing to have a clear idea of exactly what we're doing, of the goals that we are to accomplish. And Christy and New were really helpful in this. And Christy, in fact, is going to respond to that today, later on in our meeting. We did briefly discuss last year's proposal to recenter the planning on BIPOC AIAN populations as the priority populations. But there were several concerns that were raised about how this would affect the relevancy for rural areas. There is poverty, many adverse childhood experiences and issues in the rural areas, which are predominantly white. And these issues do truly go across all racial and ethnic lines. So our concern is that we do want to focus on all of Oregon while keeping our priority populations of BIPOC, AIAN when it comes to equity and other issues. We really want to maintain maximum transparency between our steering committee and the partnership as a whole. We're going to be providing reports of our meetings and other meeting related information in the base camp and also in Friday update emails. But we ask you to communicate with us, and we'll do our very best to communicate with you, because our purpose is to be able to represent in a small way the partnership as a whole. So that's a quick overview, and would welcome any questions you might want to ask. Well, none being heard. Christy and New, I'll pass it back to you. Good to see you guys.
Great, thank you, Stan. Just as a reminder for folks that you all accepted the positions. So for those on the steering committee, we include Connie, Esther, Stan, and Alicia, right? So if you folks, and then in early next year, we will also have the addition of Susan on the work group as well. So if you folks want to reach out to any of those folks who are, you might have already established a working relationship with and want to talk with them directly, we do encourage you to do that. As Stan said, this group was really fantastic in bringing forward some of the concerns and really open about discussing and kind of sharing with Christy and myself about what might we do to change some of the process pieces. So one of the things that we'll do today is as part of reaching consensus on focusing on the strategies, what we did want to do is offer it up in a different format. And I'll share with you real quickly. Part of that is in the last couple meetings, we did it kind of by a roll call, just because it was the easiest way to count who is here and get a verbal yes, no. So what Christy and I will do this time is for consensus voting, we'll do it by a poll. So we have access to a poll. And so you'll be able to vote via a thumbs up, a thumbs down, or a thumb sideways. And we'll go over that a little more. And so it gives it a little more anonymity, which I don't think is a super big deal with this group, because you all are very open and honest with one another, but it does offer that opportunity for folks to visually see where folks are landing. And so we're going to try that out as a process this time. Let's see. So the next thing that we want to cover for this group is that we're going to share with you a graphic that we've heard from the steering committee that there was still that need for clarifying of roles of the partnership. And so this particular graphic, I'm going to have Christy go over it, and it really kind of helps give you a visual I know we put a lot of written documents up, but this might give you an idea of how we envision the partnership and the roles that you all are taking on. So Christy, I'll turn it over to you to kind of give a descriptor of this.
Sure, happy to. Yeah, so I think as Stan said, in the steering committee meetings that we had last month, there was it was great to connect and hear kind of where some confusion was still existing and where we could provide a little bit more clarification and context, especially as you start to identify the things that you really want to dig into in this next year. And this graphic, maybe you've seen it before. This comes from Collective Impact, which is kind of a guiding framework that we've been using here within the public health division as it relates to state health improvement planning. A lot of community health improvement planning efforts also use Collective Impact, so it can be really helpful. And if it's of interest, we'd be happy to provide a little bit more information about that, about those principles if they're new to you. But this is an image that comes from Collective Impact and basically tries to illustrate the kind of the three parts of collective impact that work together and lean on each other, and how they are connected but distinct. So here we have the strategic guidance, which is provided by the steering committee. We have backbone support, and then we have partner-driven action. And so just to provide some examples of what these mean in the context of your work together. So you are the steering committee, you are the partnership, you provide the strategic guidance in this work, you make the decisions, and those decisions get implemented and supported by the backbone agency and the partner-driven action. OHA is the backbone support. We are a self-identified backbone agency for the State Health Improvement Plan. That is not necessarily best practice for an agency to self-declare themselves as the backbone, but that is what has happened. And certainly, again, it'd be great to have some conversation with you all about that and about OHA's role in the backbone. But for now, we are here, and we are here to support you. We are here to guide the strategy and support alignment of activities as directed by your decisions. We help to establish measurement, cultivate community engagement and ownership, again, as directed by you. And we will help to advance policy and mobilize resources, again, under your direction. And then partner-driven action, you see this is the big bubble to the right. This is where the work actually happens, right? This is the implementation of the actual strategies. And there are various working groups that sit out here. These could already be existing working groups. They might be new working groups that are needed, again, based on the strategies that you all prioritize. You'll see there's lots of various actors that are participating in implementation. These could be community partners, nonprofits, funders, businesses. A lot of you in your specific agencies are probably participating on these working groups. But you'll see that the steering committee is really separate from here. So we're not necessarily asking you to participate in implementation, although you might already do that. But that would be a lot of work, right? That would be like a full-time job for all of you. So hoping that you would see yourselves as over here as really providing the strategic guidance and direction to the working groups that exist already, or that OHA as the backbone will take responsibility for helping to stand up again under your direction. Any questions?
I do have a question, Christy. This is Kurt.
Hey, Kurt.
In the chat box, there was clarification that the steering committee is Dan, Alicia, Connie, Esther, and Susan. So that's counter to what you're saying. So I just want some clarification.
Yeah.
Yeah, sorry, I apologize, Kurt. That's the steering committee that is from you all. So back to what Christy said, you all are the steering committee in this graphic.
Got it. Thank you.
Yeah, my apologies for the confusion.
Yeah, maybe maybe the steering committee for the partnership needs to figure out a different term that you want to call yourselves, because we have a lot of steering committees. Any other questions?
We do hope this is kind of one of those pieces that pulled everything together. The steering committee of the 5 folks that's, well, what are we going to call it? We're going to come up with a good catchy name for you folks. Your partnership steering committee, really kind of like a light bulb, oh, it really helped visualize things. I don't know if any of the steering committee members want to comment on that, or if you folks feel like, okay, you feel like it's kind of coming together for you.
So this is Connie. So we're all working together, but us 5, if the partnership has their working group, they have a question about residency or public agency, excuse me, would they defer to us, or do we defer to them and give them resources, or is it the other way around?
Can you say your question one more time, Connie? I want to make sure I understand it.
We're the steering committee,
Mm-hmm.
and then we have working groups. So the working group, if they have issues with public agency or residency, or how the rural community, the little community versus the big community works, do they defer to us, or do we defer to them? Do we work to, if they have issues, if we came up with an activity to support their business, or wait a minute, let me start from the beginning. If a nonprofit organization comes to us, the steering committee, do we take it to the partnership? Or if the partnership has one, do they take it to us? That's the bottom line. Do we work together? If they have questions, they give it to us. If we have questions, do we give it to them? I mean, I'm looking at the backbone support. And if we advance policy, where are we getting this policy from? From the partnership, or yeah. I'm looking at the guidance, and the steering committee seems to be going from the left to the right. And the partner-driven action seems to be going from the right to the left. So I'm trying to figure out, do we work together? What is our role? Do we sit up there and say, okay, thank you for that information. Let's go out as a steering committee and see what resources we can get you.
So Connie, if I'm understanding you correctly, there's 3 pieces, right? Okay. So the steering committee here, imagine this just as partnership, right?
Okay.
This is the full group. This is all 18 of you at the moment.
Okay, got it. Okay, right? I'm there.
You and Alicia and Stan and Susan and Esther are like a little bubble off of here, right? You are a steering committee within this bigger steering committee, but your partnership steering committee is really to help guide the strategy of this body of these 18 people.
Okay.
and then, and inform the plan. The plan, the work of the plan happens over here on the right.
Okay.
And these
Okay,
working
got it.
groups, these working groups could be other state agencies, they could be coalitions, they could be community-based organizations, they could be, they look very, they're all very different, right? In
Mhm.
terms of who's working on what strategies.
Okay.
At this time, the partnership really doesn't have any money to
Okay.
provide resources, so people aren't going to be asking you for resources.
Okay.
But these working groups certainly may ask you for recommendations and guidance.
Got it. Okay.
And maybe I'll move on to the next slide here.
Yeah.
I think this is another way to think about this and see this. So maybe for those of you who have a little bit more of like a linear brain, this will make sense to you. And this is like a draft implementation and work plan. And I'll walk you through this here, but so the column here on the very far left, these are 3 strategies that are currently rising to the top based on the surveys that you've taken and based on the conversation that you've had in the meetings.
Mhm.
So increase affordable housing that is co-located with active transportation options. That's coming up as a pretty important topic that you all want to focus on.
Okay.
Second column here, priorities, economic drivers of health. This is the initial priority
Okay.
that this work came from and the subcommittee that this particular strategy came from. So you can see kind of what priority this is attached to. There are some example activities in here. These provide a little bit more information and context about the strategy. These are really up for discussion and debate and decision-making by all of you. A lot of these strategies are really broad and encompass a lot of different activities and will likely need some further prioritization. A short-term measure was established for each strategy, again, to provide a little bit more communication value about this particular strategy. The measures aren't going to be perfect, especially where strategies are really broad. But for example, the measure for this particular strategy is the percentage of people who use active transportation, meaning they bike, they walk, or they use public transportation to get to work. And that was only 10% of the population of Oregon back in 2017. Then the 2 columns on the right here, potential implementation partners and / existing plans. So this is really where those working groups come in.
Okay.
Right? So increasing affordable housing that is co-located with active transportation options. There's a lot of work that's happening here. At the state level, that work is being guided by Oregon Housing and Community Services. They have a statewide housing plan. And then the Oregon Transportation, ODOT, Oregon Department of Transportation, is obviously overseeing the active transportation and expanding that. And they have a lot of plans that also speak to that.
Okay.
So these would be the folks that would be taking, recommendation, guidance, feedback from you, but you're not going to be giving ODOT or Oregon Housing money.
Okay. Got it.
They've got money. And your role might be to say, hey, that's not really working. The rollout of that isn't really working very well in my community, and here's why.
Okay.
And then you'll see the last column here, the partnership work plan, that's blank. And that's really where we're hear from all of you. Well, what do you see this meaning for your community and your agency? And what does that mean in terms of communicating and drawing alignment and connecting this to your community health improvement plans? And are there additional partners that we should be thinking about and communicating to? And so once you kind of land on these strategies, we'll be really looking to you all to fill in, additional partners.
Okay.
And more importantly, kind of what it means for all of you and the work that you want to do together.
Got it. Okay.
Does that help?
It does, because I read all this, but I guess I needed clarification. That's all. Just in layman's terms.
Thank you, Connie.
Thank you all.
It's pretty wonky here, so
and that's why I wrote in
on
there. And that's why I wrote in the chat, there's no such thing as a stupid question. So that's why I had to ask it.
No, absolutely. And I think it is just like Jennifer said, it's helpful for everyone to hear it, and
yes.
And we want to make sure that we give you time and space to process that, because you're probably not the only one with that. I need some clarification thought. And so thank you, Christy, for offering that. that up and that explanation. How about others? What else can we help clarify? And we can talk it through. We felt that visual was really helpful in just, again, laying out the scope of what the partnership is trying to do, right? And our role in that.
Hey, New, this is Connie. I was
Mhm.
looking at the implementation area for number 2, and I was reading an article in one of my magazines, and this is something we don't talk about. We don't talk about people with allergies when we talk about food, do we?
Mm. In what way are you specifically
So
asking about people with allergies?
let's just say OHA is giving away food boxes.
Mhm.
I'm doing an event on the 4th, and I did not, because I didn't approach that area, with some people can't eat eggs, some people can't eat
Mhm.
cheese, some people are allergic to bananas, some people are allergic to, I don't think we as a committee, a partnership, city, town, rural area have ever talked about that. And that's something that I think when we start to have services through the Oregon Hunger Task Force or the Partners for a Hunger-Free Oregon,
Mhm.
I think that that's something that should be addressed. Would we do
Mhm.
that as a partnership?
I think you're raising a really good question, Connie. I would imagine that for our partners, such as Partners for a Hunger-Free Oregon, and I've worked with them in the past, they definitely have a good sense of knowledge about what, for your example of food boxes, what would make for a good food box, right?
Okay.
So we really trust our local partners to have that detailed information readily available. They have the knowledge around it. They are the experts. And I'm going to say you all are the experts in part because I know many of you, Christy, and I understand that many of you are already working and doing some of that implementation piece. Now, to your question about whether the partnership forwards information around, for your example, food allergies, I would say we're probably more closer to offering information on policy, probably more offering information on things that are coming down the pike at a higher, at a bit of a higher level, because those folks at the ground level who are doing food insecurity work, they have a good handle on, their awareness is very high about what might make for a better food box for our communities, right? And if OHA has knowledge of something in the latest research, I would imagine we can filter some of that down. But I think some of that really specific information, our local partners, our local work groups out there do have a decent handle on it. So when we talk about implementation of area strategies, we're really looking at some of those strategies that we've been covering all summer. We've been looking at those detailed pieces. I don't know if that helps or not, Connie. And Christy, I don't know if you would add anything.
It does,
to that.
but I was just going to say in Cave Junction, they have boxes for people at DHS, and a lot of food, you'll see stacks of certain things. And I asked the ladies at the DHS, how come? Well, their kids are allergic to it.
Yeah.
So, or there'll be bananas there that are rotting. Their kids are allergic to it. They can't eat citrus. They can't.
Yeah.
So that's why I brought it up about to increase the access to affordable, healthy, and culturally appropriate foods.
Yeah, for sure. Yeah, and I think you're bringing up a really good point. Again, as a strategy, how do we offer up that information and support people and support with the appropriate resources, right? So if those things we know are causing our communities, less access to certain food items, then is there an alternative, or what else can we offer folks, right? So that there's this ongoing conversation about that.
Okay. Thank you.
Yeah. anything else about that particular graphic or this example of the implementation? One of the things that we also heard from your smaller steering committee is that we wanted more time to process information. So we're really trying to offer that as an opportunity for you folks too. So please don't hesitate to stop us and ask for more clarification. All right. So what we'll do now is we're going to go ahead and move into our discussion of strategies. Last month, we took some time and opportunity to break up into groups and examine some of the strategies, a little more detailed with smaller groups. And we did that via the method of using Jamboards. So it's just another opportunity to move stickers from one place to another place to determine whether, what we thought, what our feelings were around specific strategies. And so before we go into that, I would ask that we would launch our first poll and kind of get an idea from folks to determine if we want to continue to have more time to process and discuss strategies on the Jamboard. So the question that we're asking you is how comfortable, what's the question, Christy? It's the, we wrote it down and I didn't have it here in my notes.
Yeah. So based on the results of the 2 rounds of surveys and discussion from the last meeting, there are 17 strategies that were currently sitting at the top, and the strategies that you wanted to prioritize for next year in terms of where you wanted to get started first. So the question is, are these the right 17 strategies? How ready are you? Do you agree that these are the strategies you want to move forward with? Should I launch the poll? Ready?
I have a quick question.
Okay.
Do we have these in, so these are the strategies that we have, right? But are these ranked or are these just kind of random like this?
Yeah, these are just the 17. And we're not trying to get you to consensus right now. I think we're just interested in kind of seeing where people are at.
Okay.
Right.
Awesome. Thank you.
Yeah. So I don't think we're going to get into discussion. We just want to take a little temperature check.
And Christy, are we gauging based on just like interest and support or actual training, knowledge, expertise to work on such things?
That's a good question.
Yeah, because I mean, like looking at some of these, like, of course, like ensure accountability of implementation of anti-racist, anti-oppression policies, totally behind it, but I'm not sure I have the skill set at this point. So I think we'll just need to just be explicit on what exactly we're saying, like, yeah, totally into it, or can we do it?
We're not looking at the can we do it right now.
Okay.
We're really looking at
Just
do these, the actual strategies. We support this. This is something that the partnership should move forward, would like to move forward on. I'm
Yeah,
trying
that's
to
helpful.
not say should, but yeah.
Mhm.
Because it's not that we believe that we can actually achieve all of these based on who is part of the partnership. It's really, these are the things that we believe should move forward. Is that helpful?
Yes, thank you.
Okay. So as Christy was saying, let's do a quick temperature check. So you're basically trying to determine, these are the things that bubbled up as the top 17 based on the surveys that we did over the past few months, and then also just having the opportunity to discuss a little more in October's meeting via the Jamboards. And these are in your packet that was sent out at the Friday email from Christy. So if you need to kind of look at it real quick, please do so. And while you're doing that, I see Connie, go ahead, ask your question. I see your hands up.
Oh, it wasn't a question. Is that a question hand?
Or a comment.
Okay. It was an okay hand.
Oh, Fantastic.
Let me lower that hand.
Mhm.
Oh, lower it. Okay, it's done.
Excellent.
New, are you all looking at the poll?
No, not yet.
Oh, okay. I'm sorry. I thought I had launched it.
We have your priorities, strategies are up, the first one, first 10.
Okay, here we go.
Go launch it again. So when you're ready, go ahead and just, let us know what you think. So as Christy mentioned earlier, there's 18 of us, 18 of you on the partnership roster right now. And we know we have a couple people absent today. So we need 10 folks for a quorum today. Just so you know.
We do have 10 new.
Perfect.
Yeah. All right. Seven people have given, 8, 9. We're waiting for one more person. All right. I'm going to close it up here in 5, 4, 3, 2, 1. Okay. We got 9 of you to vote. And here's what you said.
Share the results. Perfect. So it looks like about 56% of you are thumbs up. You agree with these priorities. There's about 4 of you who thumb sideways, have a question, comment, or need some clarification. We didn't have anybody vote thumbs down. So what we'd like to do right now is actually open it up for those of you who are willing, who voted sideways. Please go ahead and let's ask our questions to this group. Let's ask or take your comment, or what other information do you need to be closer to consensus? Ian, I see you have your hand raised. Go ahead.
Hey everyone. Apologies for missing last month's meeting. I had a work conflict and I had to drop last minute. The priorities are fantastic and really worth our time. I'm just a little concerned that we might be spreading ourselves a little too thin and not engaging sufficiently with the priorities in the way that we potentially could. So my only kind of comment or concern for additional discussion is there any way that we might be able to prioritize certain priorities, potentially drop others so that we can kind of focus in on a set of, as crazy as it sounds, maybe 5 or 7, as opposed to 17.
Thanks, Ian. Thoughts on what Ian had to say?
I'm curious, did we determine what our time frame was for achieving these things? Or did we chunk it out in a timeline?
There was something shared at October's meeting that kind of gave a very drafty skeleton idea of that, Rachel. However, kind of going back to Ian's comment too, one of the things that this group could also consider is that 17, yes, strategies is a lot, right, for anyone, right, in any given topic. Do you want to focus on 5 in the first year as opposed to all 17, and then spread it out over the second year, another 5? I mean, it might take a while, but then it does make it more bite-sized and chewable, perhaps. And I'm just throwing that out there as something that I've heard folks say.
I guess maybe a proposal would be to take the objectives that we just voted on and then spend another session deciding what the timeline for them would be. is it the case that these are going to be our only objectives for the next 3 years, or will there be additional ones added on?
Of the 17, Rachel? I don't know, Christy, if you want to answer that. I can't
Yeah.
imagine adding more after 17.
So in total, right, there are 62 strategies.
Yep.
Over the life of a plan that when launched was supposed to be a 5-year plan that would take us through the end of 2024, right? But I think there are a couple of things in play here. One is that I think we would love to have conversations with you about whether or not this plan really should be a 5-year plan or could be something longer, right? I mean, why do we need to kind of keep ourselves within this 5-year plan? I mean, there are answers for that, but I think there's room to explore the feasibility of that with all of you. And then in regards to the 62 strategies, I mean, this is all in your hands, right? If you just want to say, no, we're just going to pick these 17 things and let the other, what would that be, 30 some go. If you want to add some, if you want to change them, like this is all up to you. The initial kind of thinking that we brought to you is that you would turn these 17 strategies on this year, and then next year this time we would have another prioritization process where you would turn on additional strategies and so forth. But again, we're kind of making it all up with you, and then looking towards your wisdom in terms of what's realistic and feasible.
Yeah, and Talk, I see that you have your hand up. Do you want to go ahead and?
I think Kurt has his hand up first.
I think Kurt left the meeting.
No, he's here.
Is he?
Mm-hmm.
I'm here.
Oh, my apologies. I'm
No
looking.
problem.
Please
No,
go ahead, Kurt, and then Talk.
Thank you, Todd. I did have a question around the survey return, and I know we have that discussion in the past that there was a low survey return that determined the strategies, and I thought we were going to revisit that. So my question is, did we revisit that, or did we have a better return? And these 17 strategies is based on how many of the partnership members?
That's a good question, Kurt. I believe that when we had the low return, Chrissy had sent out the link so that those members who did not reply or weren't available when we looked at those stats, they took it, and then based on the collective, this is what we came up with. This is what you all came up with as far as strategies. And so this is compiled from all of you.
Yeah, I'll go in right now and take a look at the number of responses from both rounds. I'll get that in the chat for you.
Thank you.
Good question. Thank you. Talk, and then Alicia.
Yeah, I would just like to piggyback on what Ian was saying about capacity and prioritizing what's prioritized. I just worry about some of the priorities are really large, and collectively many of them intersect. It'd be worthwhile for us to like size it, and be realistic about it. Because I do want to set us all up for success, right? And in order to do that, I think we need to size this appropriately because it's really big.
Mm-hmm. Yeah, thank you. Alicia?
I don't remember who just said it. I believe it was Kurt who mentioned about us revisiting the strategies. Because I'm looking at these strategies and I'm struggling with them, or with some of them anyway. Especially, I mean, considering that Oregon ranks, I mean, what's the that nonprofit, Mental Health America, is a nonprofit, and they look at mental health rankings and access to care and all those per state. If we're looking at, Oregon has an overall ranking in 2020 of 48 out of the 51 states. Then we're also looking at the youth ranking, access to care for youth with mental health. It's 47 out of 51 states. We are 51st out of 51 states for adults. And there is just a recent article that came, or actually today, this morning, the Oregon Capital Chronicle, and it's a 4-part series that's going to be talking about problems facing the children's mental health care providers in Oregon. I'm struggling with, reading articles like this, or where there are several families who just said, you know what, I'm packing my stuff and I'm leaving Oregon because my child will die if I stay here. But we're talking, and I understand, for example, the, building climate resilience among priority populations. Totally understand that. However, I am really, really struggling with some of these strategies when we have families literally leaving Oregon because they are terrified that their child will die, because we don't have enough access to inpatient beds for youth. We don't have enough access to providers, because providers are leaving because they are overtaxed and overburdened. And I think I only see one piece regarding workforce, investing into the workforce. But I'm struggling with this list. And I really, really hope that we can revisit it. I'm really, really, really struggling with it.
Thank you, Alicia. I'm curious, and I'm going to throw this out to the whole partnership. Do folks have, what are like some of the main concerns with the 17 potential strategies? Is it the list is too large? Do we need to have it consolidated further? I'm trying to think of, what do folks need to feel more comfortable with what's before us, as far as how do we move from 17 strategies for 2022, right? So if you're looking at it in a process sense, okay, we have these 17, what would make you more comfortable, whether it's, we did some of the educational pieces, learning a little bit more about it in the summer. Now we're at this point of, okay, how do we accomplish this? I see Kurt's hand and Rachel's hand. Kurt, go ahead, and then I'll take Rachel after that.
For me, the struggle is I'm not quite sure. We all come at different places in the state and different places in our lives, and the biases that we have, and just our experiences. And we took a survey and we identified some priorities, and really wasn't, not to my knowledge, based on a real root cause analysis, and really digging deep down to find out, are we addressing symptoms or are we addressing really root causes? I'm okay with the strategies, and I think whatever work that we do, we're going to make a difference to whatever the real root cause is. But I think we might have missed a step of peeling back that onion and trying to find out what the real root causes are, like adverse trauma, right? Huge issue in our state. And so I just kind of, that's where I'm at. I'm okay with it. I just, I think we maybe missed a piece.
Thank you for that, Kurt. Rachel?
My comment is similar to Kurt's and is largely in response to what Alicia said.
Oh, sorry, Rachel, you got muted.
Done the little thing. My comment is very similar to Kurt's and in response to Alicia. Alicia, thank you so much for reminding us that there are current things that we need to be addressing. I think it's really important that it's not just a list of priorities, but again, given that we have 3 years to do this, we should put the ones that urgently need action now at the front, and also the ones that are going to take the longest. And so fixing the system of mental health care and child mental health care is maybe going to take 3 years. And so we should probably start on that one first, and then take the ones that we need more work and that need a little bit more urgent action and put those on the front end. And then, much like Kurt said, what are the ones that we can either group to find the lowest common denominator and the root cause that we can start making a difference on? Because all these are going to take a long period of time, but what work can we get started now that if we start putting some things into action over time, it will produce some results? So I think it's just, again, like Kurt said, analyzing what we have and what work needs to get started now, and then what work needs longer term things done with it. So we just need to prioritize what we start now versus what we start next year versus what we start the following year based on urgency and impact.
Okay, Rachel, thank you. Alicia?
Yeah, I guess I just want to follow up on what Rachel and Kurt mentioned. And I think going back to having an understanding of what we're basing these strategies on, or which strategies we want to work on, and basing it on rather than basing it on our personal bias and feelings, and what kind of we see, because like Kurt said, we all see things through our own lenses because we're in different areas of the state. And one of the things that I had mentioned before, I really feel like one of the biggest pieces that's missing here is the input of the community. So while we all have access to community partners and nonprofits, and I really feel like it's important. I really think it's important that we kind of take a deep breath and reach out to some of these, especially family networks, because those are the people that work with the families that are impacted by these strategies that we are trying to address here. And while we're only 18 people, there are several family networks in our state who do this. You know, they are out there pounding the pavement, doing this work with the families that are accessing these services. I'm really, I would really like to see if we could take a minute and figure out a way to reach out to these family networks or nonprofits to get an idea of what the most urgent needs are.
Mhm.
So, because I think we could probably get a broader idea of what is needed now, rather than kind of saying, oh, well, the 18 of us, we kind of hear this, we hear that, and we know this is important. But I think getting the community involved in this process is going to be integral into being able to address these priorities
Yeah.
efficiently.
Yeah. Thanks, Alicia. I want to give an opportunity for Liz and Christy to comment on that to see. Will you folks from OHA remind us whether there were originally some surveys done with communities and through community partners? I want to say we did do some of that. And so if you folks want to kind of address some of that, that would be great. I think really helpful to the conversation.
Yeah, there were a lot of community engagement efforts and development of the plan. The first one happened in like 2017, 18. No, I'm sorry, 2017. And that was when we were developing the state health assessment, which was one significant data source for this plan, but not the only data source. And that consisted of, I think we did 7 listening sessions around the state. And then the second one happened in 2018. I just provided a link to a summary of that process that was really around identifying the priorities, the 5 priorities that are in the plan. The original partnership had combed through all of the data and landed on 14. And so we took that list of 14 to the community and said, we can't do 14, pick 5. And they provided feedback that happened through surveys as well as mini grants to 7 culturally responsive community-based organizations. And all of that data is on the website. And then the third community engagement round happened in summer of 2020. And that was really more of like a vetting process of the strategies that had come out of the subcommittee work. So subcommittees had identified these 62 strategies. I think there were probably like 65 strategies that we put out to community with the ask of, are these the right things? Are these the right actions that we need to take? If not, what else? And overwhelmingly, community came back and said, yes, these are the right strategies. There were a few changes, a few strategies got dropped because there were concerns about it, but overwhelmingly people felt that they were the right strategies. And again, we put out surveys and worked with 7 community-based organizations that provide culturally responsive services.
Great, thank you, Christy.
And all the reports and feedback and all of the results, all of that's in Basecamp if you want to take a look.
Yeah, Liz dropped the link to that in the chat. So if folks want to go back and look at that, because to address your concern, Alicia, yeah, I know that that was a big part of what this first body of work did. And so now this, Partnership 2.0, you folks are looking at that and then thinking, how do we make that next move, right? I want to touch on, I see Talk has her hand up, and then Timur, and then we'll need to take a quick break too. So let's do those 2 folks. Go ahead and talk.
Yeah, I think it's just, Christy, you answered my question or added to my comment already. I agree with you, Alicia, that it needs to be community voice, and we do so much of that. We keep reaching out, and yet the follow through is where I see is lacking. So yes, Christy, we have done a number of community needs assessments, CCOs. That's a part of what we have to do as coordinated care organizations. We actually have to come up with a community health improvement plan. We keep going out to community and keep asking them, and yet we haven't done much with it, to be quite honest. And I think that's where we as partnership can really, going back to Ian's point again, is do a really good job being intentional and purposeful, right? Instead of going back out to community and asking them again for their wisdom. And without compensation, I might add, for many of the asks.
Great, thank you. Timur, go ahead.
Yes, and this is Timur. Correct me if I'm wrong, but I think we're talking about the same thing. In a few meetings ago, or in the beginning of this partnership, didn't we talk about doing some of those surveys with community members also to kind of just help us prioritize things? And did we ever do that? I think we were talking about, we're doing these surveys, and then we also talked about having some of our organizations do these surveys in hard to reach communities.
Yeah, I think you're right, Tamara. Early on, I think when I had first stepped into the role of facilitator, we definitely had that discussion right before we looked at surveying ourselves, and then we were going to resurvey ourselves and then potentially survey community as well. Yes, you're absolutely right.
So what happened to that idea? Are we still planning on doing that, just to kind of help and see what our community is thinking about these priorities?
That's a good question. Christy, do you have any thoughts on that?
Yeah, I think, the question about whether or not it would be helpful to get additional feedback from your communities has definitely come up. But it's also been met by, I think, the other comment of, well, we've already done that, let's just get going. So I think, again, if you all decide as a group that, yeah, you do want to get additional community input into this decision, we can definitely do that. But I don't think the group has come to consensus about how you want to handle that yet.
Yeah, and I think there was talk about we can always go back to community for future work too, right? So once we start moving the plan forward, continually asking community, not just on the strategies, but for future work, knowing that the strategies were based on a lot of community input from the beginning. Alicia, I see that you have your hand up. Let's take your question or comment and then move into our break, because I want to make sure folks have that, and then we'll wrap the last 45 minutes up. So go ahead.
Yeah, I was just gonna say that that makes complete sense. What Pat had just mentioned, it makes a lot of sense. Because and maybe that is what I was trying to get at when when I say that we need to have community in mind first.
Mm-hmm.
Because all of these strategies are wonderful and great, but when we're not addressing what the community actually needs, and then, I mean, just having a quick look at the summary, the feedback, the summary community feedback, there's a dichotomy between the 17 strategies that we have and the feedback that the community has provided. Because all along it's mental health housing, adversity and trauma, mental health housing, right? But we have all the other things as well. And I think that is all I was trying to get at with my comment, is that when we're looking at these strategies, there is a huge dichotomy between those and what we're all constantly seeing and hearing and saying and talking about in our meetings that the community is saying that they need. And that's, I think, where I wanted to say, like, we need to take a step back and really look at these strategies and see if they really are what the community is saying that they need.
Great, thank you. Thank you all so much. I know there's a lot to process, and I so appreciate the openness that we're taking to do that. It's 2:05 right now. Let's resume. Let's take a quick 10-minute break and resume at 2:15. So go ahead and leave everything off, turn off your cameras, and then get your bio break and stretch break in. So see you at 2:15, everyone. Thanks. All right, everyone, it's 2:15. Welcome back. I jotted down a couple of key points from that last discussion that we just had. And I'm putting it down to put it out there so that we can kind of regroup and think about what our next step might be. So I had three things. One was that I heard from the group that we really need the follow through with the work. Two, if we're asking additional input from communities, what are the incentives for our community? And then the third thing that I heard really was, what can we effectively do to move forward? Being, we know that this list of strategies is quite large. So how do we make it so that we can actually achieve what we want to achieve as a group? Would anybody add anything to that as kind of the key points from our last discussion? So if not, what we want to do right now is we have time to think about what do you all feel that would be a sensible next step for where we're at? Do we want to talk about appropriate thing? What would you put forward? Do you want those folks to kind of, I'm going to throw out a couple ideas. Do we want the subcommittee to look at chunking things out for effectively what the partnership could do in year one, 2022, and then break it up and then have you take a look at it? Would you all want to take a look at that priority list and do some chunking on your own and then submit it to the subcommittee? What are your thoughts on that?
Ian's got his hand up.
Oh, please, Ian, go ahead.
Yeah, I really like the chunking into the work plan, and I apologize, I can't remember who said this previously. It might have been looking for alignment of priorities too. Perhaps in the chunking, we can have priorities that are overlapping or have intersections or work at the intersections of certain domains, so that when we're doing work, we're doing it in alignment with not only the highest priorities, but also opportunities for alignment and looking for ways in which these priorities can reinforce one another. And I love the idea too, if folks individually want to do their own chunking and then pass that along to the steering committee, then that can help further reinforce their work together as they start to think through how they would chunk things into these. It sounds like calendar year bite-sized, or is it fiscal year? Because I was a little confused on that.
I believe we do it calendar year. Yeah. Other thoughts, Rachel? You have?
I was just going to ask that if the steering committee was able to do or start the root cause analysis, I think that would be great for us to see, particularly because if the steering committee can work on that, they're the ones sort of that have a level of expertise in order to take on a project like that. And then the root cause could be presented to the larger committee. And then maybe if we had that groundwork done, we'd be able as a larger committee to take a look at what that analysis says and then make decisions as a whole body about which project should come first. Maybe we won't, but if we see the root cause analysis, then I think that's the step one before we chunk it out into year pieces, because I would want to see what is going to, if we start on it this year, is going to get us the most amount of impact, and then which ones should we save for later years because they take less work or they're less impact or what that might be. So I would just want to see the analysis before we broke it up into work by year.
Okay. I'm wondering if some of that root cause analysis is something that we already have within OHA to share with you folks, or reshare. And I'm just throwing that out there to the OHA folks for Liz and Christy to be thinking about. Other thoughts?
Hi, it's Connie.
Hi, Connie.
Rachel, that sounds like a very good idea. I kind of like that. I don't know about the rest of the steering committee, but that's something, if we're going to do it, I think that's a good project to start on. What do you think, Christy?
Kurt's all for it. He's already thumbs up several times for that. So I like that.
Yeah. And we will be meeting Wednesday morning. So we will take, I think that's a good one to start with. I really do. Well, thank you, Rachel. Ditto.
I agree, Connie. I think it'd be a great one to start with.
Yeah. And we're not overlooking the rest of the group, but there's a lot of gaps in these priorities and these things. Some can be combined, others, I think they're there, but okay, I'm going to say it. In the big cities, they probably got to vote on these priorities. But here in Old Cave Junction, I don't think the papers came through. So that's why I say it's good that we're going to, as a steering committee, we're going to talk about it, because we're really going to have to take it apart and probably put it back together again.
Okay. So I'm hearing that for some of the follow-up or the next steps to do's we're asking the sub-steering committee of the partnership, our 5 leaders, to really look at the root cause analysis of potentially all of the strategies and really try to help us identify some of the root causes of that, to help us determine whether those things get bumped up as longer term projects that might take more than 1 year to really implement. And am I hearing that correctly?
Right. And also maybe at the steering committee, we will, sorry, Ian, I only have 2 more seconds because I'm an old lady and I got to say it when I could say it. Okay, don't laugh. When we could, oh God, never mind. I'll put it in the chat. Go ahead.
No,
you better
you
finish.
go, you go.
Yeah, I'm a 90-year-old at heart, if you can see the sweaters that I wear. So
Okay,
I feel
okay.
like you and I are kindred spirits. So please finish, Connie.
Okay, so what I was going to say, of the 17 priorities, because mental health can cause houselessness, can cause food disparities, can cause adverse trauma. So I think that once we start the ball rolling with the steering committee and the next person that laughs, I'm signing off. I think if we could combine them, that's why I said combine them, because from 17, it may be only 5. Does that make sense to everybody?
Yeah, Connie.
Okay, that's it for me. The old lady signing off. Not signing off. She's going to mute herself.
Yeah, don't sign off. We need you. That's helpful, Connie. I just want to make sure we, for the backbone folks, OHA staff and myself, to really understand what it is that this group wants the sub-steering committee to do, right? And it sounds like, thankfully we have you in that subcommittee to help guide that process for us. And so we definitely want to move forward to knowing and understanding that better. We will have something hopefully by the next meeting in December for you all, if not sooner, so that we can kind of keep moving forward. My suggestion may be that for folks, when you look at the strategies, to go ahead and do your own prioritizing. you know, and then see what that bumps up when you actually see the root causes and see if that doesn't change things for you. Because I think there's work that can be done in conjunction with looking at that root cause analysis. I say that because I think y'all are kind of excited and really wanting to look at how you would necessarily do some chunking and prioritizing for the years too. I think that's actually very helpful for the subcommittee too, to be looking at what you have come up with. All right. So where else have we landed? I want to make sure that, what about for the folks who felt that we needed more community input? I don't want to leave that dangling out there. Do folks still feel like we need to kind of go back that route?
Hey, New, I just
Yeah.
maybe circle back to Ian first.
Please.
Yeah, I just wanted to dovetail back to Rachel and Alicia's comments about the root cause analysis. So to me, I work in academia, so I could see multiple PhD theses being written with root cause analysis for each of the individual priorities. But maybe y'all, from your lenses and work, have root cause analysis that might be single pages in length. And so I'm wondering if you could share maybe some exemplars of the best root cause analysis, just because I know that resourcing on the OHA side, and I'm making an assumption here, is probably limited to be able to produce these. Plus, like 17 to me seems like a lot. And then the capacity of the steering committee too, we might be asking a lot of them, but maybe I'm thinking wrong here, right? Because a root cause analysis to me could be a size of a manuscript, or it could be something kind of smaller. So I'm thinking that, like, embedded in the group of all of us together, we might have some great starting places, and then OHA, might already have some documentation that we could bring into the fold, just so that we reduce the workload and leverage the extant resources that we have and work that's already been done by PartnerSHIP past to be able to inform the creation of the priorities.
Yeah, thanks, Ian. This could be a big project, right? And I also kind of want to attend to the fact that I think we do have some people that want to kind of get going and start to take action on some of these things. So one idea that I'm thinking about right here is using the Bar-High framework for the social determinants of health. And we could kind of plot these 17 strategies, or all of the strategies really, along that framework. I don't know if that would be like a traditional root cause analysis, but it might be one way that the steering committee could start to look at this. And I can pull that visual up if y'all are like, I don't know what you're talking about.
Bar-High was used from its Bay Area regional work done in San Francisco, Oakland, Bay Area, and it's used as a framework in a lot of the social determinants of health work that we do in the public health division. So
yeah, and basically what it's going to do is it's going to pull out all of the strategies that really get down to the roots of institutional inequities first. And the things like behavioral health services and access to preventative healthcare services and more of those direct social needs services would come later. So again, it's one option, and we'll do some thinking ahead of Wednesday's meeting with the steering committee and look at the steering committee members as well to come up with some ideas on how we might tackle this in a reasonable timeline.
Can we get so all the information that we have from the community, in like all the community feedback, because I think one of the easiest way for my brain to work and to see it all is to have both pieces. So the input from the community that we already have, and then our strategies and the total strategies, and then the 17 strategies that we currently have as a list. Is that something that we could have for the steering, or ready readily available for the steering committee. So we can start working on that.
Yeah, I'll send you links to all of that tomorrow, if not later this afternoon.
Also,
thanks.
Christy, can I ask a question? Because there are no dumb questions in the partnership. Will it be, these surveys that were taken, were they categorized by race, by gender, by age? They were, okay.
Yep, we can disaggregate all of the responses.
Okay. And Ian, you could be on the steering committee as a visitor if you want.
No
It's
way.
okay.
I saw Rachel's comment in there, telling me, and so I'm shrinking now.
You're welcome.
Yes,
You could be
you all are
welcome.
welcome.
You could be a visiting steering committee member. How's that?
That's a lovely offer, and I may take you up once I can start treading water a little bit in a couple of months.
Thanks, Ian. Thanks, Connie. I want to also touch base. Did folks want an opportunity to kind of look at the strategies again in the Jamboard fashion that we did in October? I don't want to neglect the fact that we do have a little bit of time. What do folks want to do that, or do you feel like we can kind of move forward with the discussion without having to go back and do small breakout rooms to look at the strategies?
I think if we saw this, what you just said,
The Jamboards.
thank you. The ones that were already done, I think that would also help the steering committee to have a base of where to start.
Okay. So with that, then, Christy, do we want to just do one round of Jamboards today? We do have the time, and then what we'll do is we'll wrap things up and we'll have a little debrief after that, and then give folks membership partners to give any type of updates on work that you've been doing. We will have time for that. So maybe we'll do like 10 minutes, Christy, or 15. What do you want to do?
I think 15 is good.
Okay, let's do 15.
It'll give me a minute to
Sure.
get these organized. And I'm also wondering too, as you're all looking at these, if you start to see some strategies that you think are root cause, you want to like give those a little stamp or a little circle or somehow call those out.
So as Christy is setting up the rooms, what we'll do is we'll break you out into smaller groups, 3 or 4 folks into one breakout room, and you'll have the opportunity to look at these Jamboards, and you'll see the strategies. Feel free to make comments, move them around. It's just as if we were together in a room together. And so you can move things around on sticky notes, add comments. And so that helps the group to process as well.
Okay, I think I've got you all ready in groups of 2 or 3. We'll bring you back at around 2:47 or so. And you all got the link to the Jamboard in the chat. Have fun.
Thanks, everybody. Our time together, what we wanted to do is actually give folks a little bit of time to share about what's happening in any type of member updates that's happening in their communities. Rachel, I see that you have your hand raised. Did you have a quick comment?
I don't want to interrupt. Something came up in our room that
Please.
wanted to share out.
Please.
Okay, I will interrupt then. Talk and I were speaking. Talk is from Health Share, which is a Medicaid, Medicare provider. Many of you probably know that. However, what we were starting to look at was, and started to connect the dots of, the social determinants of health, they came down from the state, and they are very specifically designed to address the priorities that we were given. And every CCO is required to create a plan to address those. And so we started by talking about wow, isn't it crazy how all these coordinated bodies are trying to coordinate, but they're all doing it in silos. And then we started to think, I wonder if the role of the partnership is for folks like Talk to come and say, this is all the incredible things. Because, you know, she was looking at all the priorities that we were looking at, and she's like, yeah, we've got a thing for this, we've got a thing for this, we've got a thing for this. And I was like, oh, that's so interesting. What if the role is people like Talk come and show us everything that they're doing under all of those state mandated priorities, and then we, the community, let her know, I've never heard of this, you guys are totally not landing, the community is not buying into what you're trying to sell us here. And then we sort of help them understand from the community's lens what it is that they're doing, or more importantly and more specifically, what are they missing? And so we were looking at all those priorities, and Talk was like, we're doing all these things. And then we started to ask, well, what are you not doing? And then from the community's point of view, what is it that's not landing with the state of Oregon people that we need to start addressing? So I just wondered if perhaps we had a misunderstanding of our role. Anyway.
Yeah, no, that is a big part of it, right? This plan is meant to be a tool for alignment of health improvement efforts across the state. So yeah, I mean, I think Talk and Rachel, you all have this like geographic overlay because you both work in agencies that serve the Portland metro area. And Talk, like, you are the person who is representing coordinated care organizations. So it's not only about like, you know, working locally in your community, but it's also going to the other CCOs across the state to say, hey, we all need to get together on this and start moving in the same direction.
So then I'm curious, is the partnership, what, you know, we're taking a look at all these strategies, we're saying, what should we work on first? What are we talking about when we say, what should we work on? Does it mean that we need to figure out how to invest in, you know, rural internet access? Or is it that we need to find the organization that's doing that, and then we need to highlight those folks and say, look, the state of Oregon is doing something.
Yep.
And if you don't have enough money, great, because the state of Oregon said this was a priority, so y'all said you would fund it, here you go.
Yep. Yeah, no, that's exactly it. And I think that's a really good example because that's kind of easy to understand, right? Like internet access. And Business Oregon is the state agency that, you know, is in charge of ensuring broadband access. And there is a broadband strategic plan that's all about how do we ensure that all people in Oregon have access to affordable broadband. And so, yeah, it's about bringing Business Oregon to you all, having them share out, like, here's what's in our plan, having you all say, hey, that's working this way, or that's not working in that way, or have you thought about doing it this way? It's about thinking about your individual agency. So Talk, again, using the CCO example, it would be, oh, this is really important, and carrying that message back to Eastern Oregon Center for Independent Living, to Eastern Oregon CCO, maybe getting together with Kurt, who's also in Eastern Oregon, and you know, and being the liaison with those communities around how to, you know about that plan, tap into the resources, and de-silo the efforts.
So then I guess, thank you for saying that. I guess coming full circle, when we're talking about prioritizing these pieces, what's the purpose?
It's about what do you want to dig into first, right? Do you want
like what information do we need, not as opposed to like what work do we need to go out and do?
Right, because you're not really doing the work, right? You're providing strategic guidance to the state agencies and to those who work via community health improvement plans, formally or informally, about how to de-silo and get more aligned with the efforts that are going on. So yeah, I mean, because, you know, we want to be mindful of your time, right? You signed up for like a 4-hour a month commitment. We don't have any resources for you at this time anyways. We don't have any resources for you to go out and allocate, but it's more about providing a communication channel from community, which is all of you, to these state agencies and other partners who are responsible and do have the resources to implement.
So the idea is we prioritize those pieces. The folks that we prioritize first, because we were talking about the years, then the folks that we pick that we want to hear from first, they come and talk to us, and then we learn about them. And then afterwards, we go and tell all of our friends and family and people that we work with, and then we move on to the next one.
Yeah, if you want.
Or it can be done simultaneously with other things, right? It doesn't have to be next. It could be several of them being implemented at this same time, right?
Okay.
So back to that example of internet access, that can be going on at the same time with housing and food insecurity discussions. So you all are continuing to advance and forward the information and agenda, right? Whereas those smaller work groups in your local communities across the state are actually the ones doing it, So to free you from the burden of feeling like you got to do something or do it all, don't feel that burden, but think about how do we collectively push ourselves as a group, saying we as a body are saying these are things that should be talked about and communicated to communities across our state, right? So for you, family involvement and ACEs, adverse child events might be a really top priority, and then housing might be another one for somebody else. But it's not like we're going to choose one over the other. Sometimes one will go first, perhaps in the stream of things, and something else will still be part of that, but come later. So hopefully that helps.
Yeah. Another example I'll just share too, and then I see Alicia's got her hand raised, is related to like legislative session, right? A lot of these things will take a legislative change. And right now is when state agencies are starting that planning and that conversation about what they want to put forward for the 23 legislative session. So, I mean, not to like put a sense of rush on y'all, but the sooner that you all can say, hey, these are the things that we think are really important, the sooner that we as OHA can start folding those priorities into conversations around what OHA and other state partners want to take forward in a 23 package. So if you say, yeah, or, affordable housing, that's the thing, then tomorrow when I go to a legislative meeting with folks from public health, I can say, hey, PartnerSHIP is saying they think affordable housing is the thing you all need to focus on. And let's figure out what OHA's lane is within that world.
Got it.
That's another
Thank
example
you.
of how this information would get used.
I am glad you guys suffered through me coming to understand what y'all probably knew already. So thank you.
It's okay. It takes a long time.
Yeah. We have a couple minutes, and I'm going to give Alicia, go ahead and take a minute if you want, and then I'll wrap everything up in the last few seconds that we have today. Oh, and Kurt, I see you too.
Actually, I really appreciate that, Rachel, because I kind of just listening to this, I think I'm just a tad bit more confused than I was before, to be honest with you. So, because I'm wondering, so if we're going to kind of reach out to other different agencies and departments and whatnot, and people and entities to come and talk about what they're doing and what they have to offer, and then kind of dispersing that back out the community. So my question is, I'm going back to the rural versus urban, right? Rural versus city. We know city has more to offer than rural. So what if, what happens when we have city coming in and saying, hey, we have all of these amazing, wonderful things, and, we just need help getting this out to the people in the community, and somehow we keep missing people. And then we have rural coming in and they're like, yeah, we have all these great things, but their list is like this versus city's list is like this. And half of city's list could be also used in rural list. How do we address that? Because I mean, a lot of times in the rural culture, what we have going on here is that, oh, we're doing all these amazing things and look at us and we're just great. And then we're like, oh, wait, Portland or Salem has all these really cool things and much better access to care and so on and so forth. How do we address that? Because we can't just tell rural people, hey, go to Portland. Because that's not how that works, especially if you're in a CCO. You can't just go to Portland or to Salem.
Yeah. Yeah, thank you for that, Alicia. We're at time and I want to be respectful of folks. If you want to stick around for a couple more minutes, Kurt, I'm going to let you have the last piece. And I want to let us all kind of sink in and let that marinate with us, what you said, Alicia, because I know we don't have a lot of time to process that today. I would encourage us to take that back to our steering committee on Wednesday and continue that conversation. But Kurt, you had your hand up. I'm going to go to you and then we're going to close out today.
I appreciate that. Just to give you a quick update, we have been addressing the culturally and linguistically delivered services issues that were brought up during our partnership evaluation over the last maybe 4 or 5 years. Some great news is that we've been advocating with the state agencies, and vocational rehab has agreed to pay for those services, language line, interpretation and translation for their contractors that need such services. You know, there's not much difference. They say that, well, the contractor is liable to provide those services. But in the contractor's mind, they're always concerned about cost. And so I think this just eliminates one barrier and makes more services available to individuals from our minority communities. And we have other agencies that are doing that too. Another example of it is our Afghan relocation into Oregon. A lot of our agencies are translating their documents, their outreach documents, their forms in Dari and Pashto and Farsi, the languages that are used by our Afghan community that's coming into Oregon. So I think there's some success there. Last, I'd just like to share, we were successful in getting Judy Human, and those who have watched Crip Camp may know Judy. She was featured in that film, has done a PSA around COVID vaccines for Oregon. And so that is out at our Facebook pages, and I'll make sure to send Christy a link and get that out to all of you. So thank you.
Thanks, Kurt. I appreciate everyone's time today. We will resume on December 6th, I believe, for our next meeting. So thanks, everybody. Have a great afternoon.
Bye, everybody.